video is going to cover instructions for your upcoming facelift surgery. So remember, 2 weeks before your surgery, it's important for you to get off all blood thinners. The night before your surgery, be sure you go over all of your instructions, get everything together so that you're ready for the next day without any stress. Now, the morning of your surgery, it's important for you to get as clean as possible before you come in to see us at the hospital. Most of the bacteria that cause infections after surgery actually come off your own body. So we're going to be making incisions in general for most people, possibly if you're having a brow lift here, around your temporal area, around your ear, behind your ear, and right underneath here. You can use the HIPAA cleanse that we give you in the office and even an antibacterial soap like Dial to really scrub these areas well. So what my recommendation is put them on the corner of a washcloth and really get in there and clean the morning of surgery. You can also take something where, like an antibacterial soap, put it in your hand and get in there and scrub the heck out of your scalp. Now you will be a frizz ball after that, so go ahead and use your own shampoo and your own conditioner afterwards, after you've used the antibacterial soap. But don't put any hair care products in or waste time styling your hair or putting on anything on your skin lotion wise other than just hydrating serum that we have in the office if you're having a laser procedure as well. So 8 hours before your surgery, it's important that you not have any full liquids or solid foods, and in general people can have clear liquids 2 to 4 hours before their surgery, but these exact instructions will be given to you by your anesthesiologist. We do recommend that people take a Dramamine with a small sip of water before you come into the hospital, and your anesthesiologist or we may tell you that you might need to take some other medications as well, so that will vary from patient to patient. You show up about 2 hours before your surgery, and I will see you at about half hour before your surgery and put the markings all over your face. If you have longer hair, long enough to put in a ponytail holder, please bring a couple things like that with you. Maybe even a headband, bring that with you to the hospital. That might be helpful after your surgery. So when you wake up from surgery, some people are wrapped, but in general I don't do dressings afterwards. You're going to have incisions both in front and behind your ear and underneath your chin area for most patients. Using an antibiotic ointment like bacitracin ointment or polysporin or neosporin can go on those incisions twice a day. Whether you want to put those in your hairline is kind of up to you. It can make things a little bit greasy. I'd say for the first couple of days it's a great idea. We have little teeny blue stitches in these incisions that will come out at 4 days. If you have incisions in your hairline area here, that may have staples. So if you are going to be combing or brushing your hair afterwards, which I think usually just fingering your hair after a shower is probably a little bit easier, just make sure you don't drag that across those staples because it can be uncomfortable. Now we also use a very teeny tiny drain. It doesn't really look like, this side looks like what you'll have, but on this side it's about the size of a small piece of linguine or spaghetti, and that comes in down here and travels up into your cheek. And in general I take these out in the hospital before you go home the next day. In some patients, if there is a little bit of extra fluid coming out, we may send you home with this, and all you need to do is basically pop the top open, empty the fluid that comes out, squeeze all the air and put the cap back on, and just record how much is coming out every day. So the vast majority of you will not go home with a drain in, but if you do, it's important that you just know you need to empty that once or twice a day while you're home, and we'll take it out at your first follow-up appointment. Now, positioning is really important after this surgery. You want to make sure that you're keeping your chin up at least 90 degrees. We don't want this. We want this to stay nice and open, because when you come down like this, it causes a lot of wrinkling, and also because that skin is very tight, it can put excess pressure on right here. So keep your chin at least 90 degrees and try to move more at your waist rather than at your neck. People who are really animated tend to be like, oh, hi, and they're turning and moving a whole lot. Really be as boring as possible. I say, like, be like the Queen of England. Hello, hello. Don't make a lot of facial expressions, and try to avoid anything that would make your face turn red. So if you drop something, go down like this and pick it up. Don't bend over here. Try to avoid things like vomiting, coughing, any type of exercise that makes, like straining on the toilet, anything that would make your face turn red. It's important to try to avoid that. We're also very strict in following people's blood pressures after surgery. Every day that goes by, your risk of getting a hematoma or bleeding in the surgical site goes down. Men have about 5 times the risk of bleeding after surgery and getting a hematoma than women. And while the majority we're going to see bleeding complications in the first 24 hours, I actually had a patient 8 days after surgery get a hematoma from doing a little bit too much exertion when she was home. So that's a pretty strict one. And we like your blood pressure to stay probably below about 150 systolic. So if you are someone with high blood pressure, make sure you're checking your blood pressure at home and be in contact with your primary care before surgery if it seems like your blood pressure isn't where it should be. Now, you'll also likely go home with what we call a soft pulse. This creates an electromagnetic field that helps decrease bruising and swelling. It has a battery life of about 8 days. So we want you to use this as much as possible round the clock. The only time you should take this off is if you're getting in the shower. There will be a little strap that we put on the back, but this is great positioning for this. You want these circles to kind of go around your cheek and neck on both sides. It actually still kind of even encourages you to keep your neck straight. People also like using those soft travel pillows where you can use it around your neck in the front or in the back to kind of remind you to keep your chin up. And when you're sleeping at home, you should be elevated. You can use a wedge, you can sleep in a recliner, you can stack a whole bunch of extra pillows there, but sometimes using that travel pillow right here helps your chin to stay in that nice position. Again, remember, we like this and not this. When you come back to your first follow-up appointment, which is going to be 4 days after your surgery, we will likely take the little blue stitches out on that day, and a week after that, we're going to take out the staples. Things to watch for at home: a hematoma is not subtle. It is almost instant. It is extremely painful, extremely swollen, and hard and bruised. That's a medical emergency. Now, some people will get what's called a seroma, a little bit of soft fluid that occurs down here lower in the neck. That's actually not uncommon, and it's not an emergency, but we don't want you to wait a week or several days. If you see some fluid accumulating down in here and you tap it, kind of does this little waterbed thing, that's something that we just put a tiny needle in and just suck that out to just speed your healing. It's also very common that people get a little bit of a ridge right here underneath at the distal extent of where we did surgery. That feels a little bit firm. It's maybe like about the size of a pinky or a pencil. That's not an emergency. We'll see that when you come back in, but that is very typical down back here on the sides and underneath here. Now, at home, again, chin up. Don't be really turning excessively for that first week. As the second and third week come along, we want you to get back to closer activities. But as far as exercise goes, we're really looking at probably about 4 weeks before somebody's ready to do something like that. At about 2 weeks, you can start scar care. Biocorneum is our favorite one. It's just a little silicone ointment that has some sunscreen in it, and you can rub that on your incisions twice a day once things are healing up well. Now, sometimes behind the ear, we have a little bit of slow healing, sometimes underneath here, so everybody's individual instructions are going to vary, but generally we start this scar care at about 2 weeks. Other things to watch out for at home, or what to expect after surgery, is a lot of times we have some muscle weakness and some numbness. So in general, if I'm showing you my bottom teeth, I know that's not a great look, but see how these muscles in my neck are really working hard to do that? We tighten these muscles in the midline right here, and we also do a lot of dissection around here. So there's some muscles that won't want to work and some nerves that go to sleep for a while. So sometimes you can get a weird lower lip position where if you were trying to show me your lower teeth, you might just be doing this. Now that may take a couple of months to get better. Long term, it may take actually about 6 months before it's really strong, but we will just reinforce what's going on. If you notice some weird animation of your lower lip, that's not uncommon. Also, ears, they don't really feel like they're your own. They're very swollen. They can feel numb, tingly, sore. So that's something else that's real common after this surgery as well. As far as your medications, we use Valium as a little bit of a a muscle relaxant, because this is what's going to hurt here and back behind your ears and your ears themselves. Those are generally the places that hurt. It's not uncommon that people do this surgery and take very, very little narcotic. So that would be something like Percocet or Norco. You have it if you need it, but a lot of patients, maybe they take it at night, but during the day can get by just with Tylenol. We actually want you to feel some of this discomfort because it helps you to be better at monitoring how much activity you're doing. We also use a lot of Celebrex. Celebrex is a long-lasting anti-inflammatory. If you're over the age of 65 or if your kidneys aren't in great shape, we may want you to not take that or just take it once a day. If you're younger than 65 and have good kidneys, you can even take that twice a day. And that's something also that's just used as needed. So hopefully this will be helpful in you getting ready before surgery, coming in nice and clean, and afterwards how to use your soft pulse. Again, there's only an on-off switch and there's no reason why you ever have to really turn it off, because as soon as you get out of your shower, you're going to put it back on. As long as that light is blinking right there, you're going to keep using that. That's generally going to be about 8 days, and you're going to start scar care generally at about 2 weeks to keep those scars looking as good as possible. So hopefully that's helpful, and you will get more exact instructions about your own surgery at your pre-op appointment.